during my patient's first couple of weeks of therapy, I would make sure that they would stay within the pain-free zone, especially with passive range of motion. The mobilization technique that I would use is a passive range of motion circumduction that I would actually teach the patient and members of the patient's family, because this should probably be done about 3 times a day to maintain movement in the zone that the doctor recommends. So I would have my patient lying, of course, on a table. She's on the floor. And I would tell her to stay completely relaxed, and I will do the movement. So I will bring her into no more than 90 degrees of flexion, usually with hip arthroscopy. 90 degrees of flexion, about 10 to 20 degrees of external, or 10 degrees of external rotation, about 5 to 10 of internal rotation are usually the precautions. So I would have her, I would passively bring her into this and holding onto her lower leg. Bring her into external rotation. You just stay relaxed. I'll do the work. And then slight extension, still of course in the flexion zone. Internal rotation. And back into neutral. And so this is just to keep those, to prevent contraction and keep the joint fluid. And then I'll go one direction, then of course the opposite direction. Stay relaxed, give me the heavy, internal, neutral to external. And as the patient's pain-free zone increased, then I would increase that internal and external rotation to almost favor and almost full fader. And trying not to go past that 90 degrees. So this passive range of motion mobilization would be done within the first 4 weeks. Of course, best within the first few days, but it's a good mobilization technique to use in the first phase of hip arthroscopy.